Welcome to the Prime Health Podcast with your host, Dr. Derek Barron with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from healthcare experts for your journey to prime health in life and in business. Now, most doctors just treat injuries that present to their office, but today's guest, Dr. Laura Fralich of Northwest Sports and Exercise Medicine, helps people get their lives back. As a sports medicine physician and former athlete, she has a different mindset and she meets patients where they are and helps them to return to activity in a way that feels right to them. So before we get into the exciting episode with her, I just want to introduce you to Grow Solutions, where we have and work with brilliant healthcare professionals who don't need to choose between patient care and practice growth. We actually help on the growth side of the business. So if you're learning about how to get in more new patients for the practice or clients, depending on how you associate with them, if there's any operational chaos that's going on in the business that you have, we have proven systems and frameworks that can help with that. And yes, we do help with AI systems and AI agents because the robots are coming whether we like it or not. So if you've ever said this or thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we can be your growth solution. So just drop the word grow below. Either myself or a team member will get back with you, or feel free to send any message to me on the social platforms. But let's dive into today's episode and meet the star of the podcast, and that's Dr. Fralich. And Dr. Fralich, welcome to the Prime Health Podcast. And please tell us a little bit about yourself and what you do.
Derek, thanks for having me. I appreciate the invitation. My name is Dr. Laura Fralich, and I am the physician and owner of Northwest Sports and Exercise Medicine in Spokane. I've been in private practice for about 16 months now. Prior to that, I was an employed physician for a couple of different health systems. My background is in family medicine, so I'm board certified in family medicine. And then I also did a sports medicine fellowship at the University of Massachusetts and am board certified in sports medicine.
So most people, when they say board certified in sports medicine, think of, okay, it's got to be an orthopedic surgeon. That's not the case and I don't mean to say that negatively, but many people think of that it's only associated with orthopedics.
Yeah. 90% of musculoskeletal injuries don't require surgery.
Yeah.
And so sports medicine physicians fill a nice niche between primary care or other medical professionals like chiropractors, physical therapists, et cetera, that we usually work with. And we can often help patients avoid surgery. We love our surgeons, thank God for them. But there are many times when patients either don't need a surgery or don't want a surgery. And so we often fill that void for them.
Yeah, we'll get into more on how you do that. But I do want to go back to maybe kind of the impotence of what you do. That was there a moment in your life, younger, as you getting older, that said, I want to choose a career path in medicine?
Appreciate this question because I think every physician has a different answer. But I'm that doc that always wanted to be a physician, and I couldn't even tell you why. I just knew that's what I wanted to do. Interestingly, I had some other interests as I got older. And as you mentioned in the intro, I was a athlete. I was actually a 3-sport athlete and chose to play college basketball as my primary sport and got hurt. And I think a lot of us, we could go into medicine after we get injured. But the orthopedic surgeon that I worked with had a big impact on my life, helped me reach my goals of playing college basketball. And so I knew that was the direction I wanted to go when I got hurt in high school. And then I got hurt again in college, tore my other ACL, unfortunately, like most female basketball players are at risk of doing. And it just kind of solidified that, that was the route I wanted to take. Interestingly, I had some other goals as well. I was a high school math and science teacher before I went to med school. So I have a master's in teaching. I was a firefighter, so for Spokane County, and then for the Lewis and Clark National Forest as a hotshot in Montana. So I had a few other jobs before I finally decided, man, not getting any younger. I better go to med school. But this was always the goal.
Well, that's a route to get to it. Hot shotting around this area. It's like you're in Spokane, I'm in Coeur d'Alene, so the Pacific Northwest. It is something that when I originally from Wisconsin, I remember a classmate of mine, his father would in the summer times leave as an accountant and a banker, and he would head out this way to be a hotspot person. So, and my son being in school is around a bunch of guys that are doing that kind of stuff, the hot shotting. So I commend you for that. What a big risk, but I'm sure many rewards that came from it as well.
Yes. Honestly, one of the greatest jobs of my life. I considered it a huge privilege and honor to be able to serve my community in that way. And unfortunately, I was never in the military. It was something I always kind of wanted to do. The hopes of going to West Point got dashed when I tore my first ACL in high school. And so, working as a firefighter and being around those types of people that are really focused on service to others was a huge honor for me.
Yeah, good. Well, we appreciate that for sure in the fire zones in these areas. So, but stay in practice. Don't go back into it. You know?
I'm too old to do that now.
So you have a unique business approach, being a sports medicine physician and, direct specialty care. Some people may be familiar with direct primary care, your direct specialty care. Could you please give us a little bit more of expand on that, how your practice is different than other providers?
Sure. Historically, people have insurance, medical insurance. And so when you go to the doctor, you usually pay a copay and then you get a bill several months later for whatever your insurance didn't pay. And so this model, direct care, is different in that we're out of network with all insurance. So I don't take Medicare. I don't take any insurance at all. And the beauty of that is that it lowers the price, the overall cost to the patient. It also allows us to see any patient that wants to see us. Oftentimes when we're in an insurance model, you're only allowed to see doctors that are in network, so to speak, or you have to pay more if the doctor you want to see is out of network. This puts all of the control back in the hands of our patients because they get to decide who they want to see. And as I said earlier, it allows our cost to be significantly lower because we're not contracted with insurance companies who, frankly, a lot of them don't reimburse that well. And so the difference between a direct primary care and a direct specialty care model is that a lot of direct primary care models have a membership fee. So every month you pay, $25 to $125 to have access to your doctor. Then direct specialty care is just that. I'm a specialist as a sports medicine doc. And so I don't have a membership fee. So my patients just pay for services that are rendered when they come in to see me. And we give them all that information up front. So there are no hidden costs, no hidden fees. You know exactly what you're going to pay when you come in. We don't bill anybody, which is beautiful. You're not waiting for a bill in the mail. And so, we work with people if there's a procedure that is perhaps a little more expensive than they're willing to pay, the total up front. But in general, people understand the model. They love the model and they get good results. And the other nice thing is that access is better. In a big healthcare system, you take a number and you wait 2, 3, 4 weeks, maybe longer to see a doc. And frankly, that's too long in my opinion. And you get 15 minutes once you do get in with that doctor, right? And so in this particular model, we can see fewer patients, spend more time with them. So we're not only improving quality of care, but we're improving access to that care.
Yeah. I think the time factor is becoming more and more important and pressing on patients ever so much. They know they're paying a premium every month from an insurance standpoint. And if they go in to see their doctor for 7 minutes, it causes a problem for them. They're still paying a premium because they still have health insurance. But when they come into your practice or practices like yours, they know what that cost is up front. As you said, there's no hidden cost to that, but they know it's not that they're spending 3 hours with you, but they have a little bit more time in your office and can tell the story and sit down and say, give me everything that's going on instead of, okay, I'm at 5 minutes now. We got to skip the rest of it. It's just not fair to the patient care or the population.
I agree with you. We can actually see more than one concern at a time, which is nice too. So they'll often kind of be apologetic about it. Like, hey, could you also look at my shoulder? Yeah, of course. Really? Yeah, of course. And I have an ultrasound, so I can do a lot of diagnostic evaluations with that and say, hey, actually, looks like you have a rotator cuff tear. Oh, you've got a little bit of bursitis. What do you want to do about that? So we can see them for multiple things. I think some folks say, well, I don't need to see Dr. Fralich for an hour. I just need to have my ankle looked at. And that's okay. It's all about value to the patient. And we can see them for really as long as they need to be seen. If that's only 20 minutes, 10 minutes, I can do that. But if they want to be seen for longer, they're my number one priority, and we take care of them.
Yeah. I love that approach of value driven. And I'll like a backstory myself. Out of chiropractic college, my first job was with an orthopedic surgeon. And we would triage into 5 rooms. He would go in and out real quick. It was in the city of Chicago. And patients would always complain about the time factor. So I said, well, do me a favor the next time. Once he comes in the room, I won't say his name. Once he comes in the room, just get up off the table and stand in front of the door and ask all the questions you want. And you could just see he was like, well, I got to get out of the room. So, he caught on. He's like, Derek, what are you telling him, before I come in the room? So I had to change that. But it's, I do think that that's so, so important. Reviews that patients give the doctors, it speaks so much to the time. And as you're saying, Dr. Fralich, the value you give to the patient. And I think it's critical.
Thank you.
Yeah. Yeah, absolutely. So you said that you had some ultrasound. Tell us a little bit how it's unique, how your practice is different than a majority of them that are out there, especially because of your sports medicine background.
Well, for us, we can see a lot of different things. I mean, we get X-ray. We can certainly order an MRI or a CT. We can order those things, but we have ultrasound in our clinic. And by using ultrasound in the clinic, I can not only diagnose musculoskeletal injuries like tendon tears, chronic tendinopathy, bursitis in a shoulder or a hip. We, believe it or not, can diagnose fractures as well in some cases.
Okay.
Really the only limitation of ultrasound is we can't see inside a joint, so I couldn't see a labrum tear or like a meniscus tear. But otherwise, if somebody comes in and they have shoulder pain, I can do a full diagnostic evaluation with ultrasound. And in some cases, it's actually better quality than the MRI that they would get. And so I can do that for far less money as well, or cost, than them going to get an MRI. So not only do I use it for diagnostic purposes, but I use it for doing ultrasound guided procedures. So there are a bunch of different procedures I can do. Certain interarticular injections with fairly long needles. So like a 3.5-inch needle, you wouldn't want to use that without ultrasound. So you want to make sure you can see where you're going. And so like when I do glenohumeral joint injections for the shoulder or an interarticular hip injection, I always use ultrasound. Okay. So it has a ton of value. I can see if people have, I've even diagnosed appendicitis, which I was an ER physician for about 6 years and could do some point of care ultrasound with that as well. But yeah, there's a lot you can find with an ultrasound.
Yeah. I think I should ask, what haven't you done in healthcare yet? So,
there are plenty of things. There are a lot of really amazing, talented, much smarter people than me out there in medicine, but I'm happy to call them colleagues. I'm very fortunate to do what I do.
Yeah. So I want to make a simple differentiation. You say you're a sports medicine specialist, but if you're not an athlete, they can still see you, correct?
Absolutely. I mean, anybody who is active or wants to become active can go see a sports medicine physician. I have grandparents who say, I just want to be able to pick up my grandkids and I can't because my elbow hurts so bad. Or I have arthritis in my knee and I can't walk my dog. Or the big one right now is pickleball, right? My ankle's killing me. I rolled it playing pickleball, or my wrist hurts from playing pickleball. We can take care of all of that. So we have people that have work injuries like carpal tunnel syndrome that we can treat non-operatively with a very simple procedure done under ultrasound guidance. So we treat injured workers. We treat people that just like to garden or, tinker in their garage. We treat it all.
Yeah. I just want the people that are hearing this to know that just, you don't need to have, blown your ACL to go and see you. It is the same thing. They could go and see their family practitioner, go to the ER, and say, well, now you got to see your family doctor or go and follow up with them. They can choose to follow up with you if they would like.
Yeah. And I will tell you, a lot of them come straight to me. They bypass the ER. they bypass their primary care in a lot of cases, but I'm always mindful to include their primary care doctors in the the overall care of that patient. I want those doctors to know, like, hey, I saw your patient, because that's their patient.
Yeah.
And I don't want to step on toes. So I really value primary care and what they do for patients. But yeah, a lot of times people just say, I saw that you take care of ankle injuries, and I twisted my ankle this weekend in Hoop Fest, and I wanted to come see you.
Okay. All right. And didn't you also in your previous career cover some sports medicine, like cover teams as far as team events?
Still do, yes.
Okay.
So currently I'm the team physician at Gonzaga Prep High School. Done that for a number of years, and was a team physician for the Spokane Chiefs hockey club here in Spokane for a few years. They're in the Western Hockey League. That was a lot of fun. I loved that.
Yeah.
I've covered lots of different sporting events, from Special Olympic Games in Seattle. That was a joy. That was a few years ago. And then the Boston Marathon, I covered that for about 5 years as well. My first year was the year of the bombing. That was the year of my fellowship. So I was right at the finish line for that event. So not exactly what you expect when you're covering a sporting event, but nonetheless, a pretty powerful learning experience for me.
Yeah.
But I've had the opportunity to meet some really incredible people, travel to some pretty cool places, sit in some dugouts for the Red Sox farm teams. I mean, it's been an incredible journey for me. I'm really grateful.
Yeah. Good for you. And I'm sure your patients are as well. I think that when people go into medicine, they're thinking the top specialties that are out there, nothing wrong with them. But I think what's unique about sports medicine is that population wants to stay healthy and get healthy. So they'll do what they can so they don't have to see you. And then when they have to see you, they want to get better. So they're driving to get improvements in their lifestyle. And those are the type of patients that you should, I don't want to take anything away from people that aren't, that way, but those that are driven to get themselves better are always fun to be around.
You're 100% right. I mean, we're lucky in that we get to work with people who are highly motivated to the point where I actually have to be pretty clear about what they can and should not be doing, because they push themselves. And so a lot of times we have to kind of pump the brakes on what they want to do and set some very clear expectations for them, say after a carpal tunnel release or after we take out, a calcification in their rotator cuff. Like, these are the things you can and can't do. And, we have them frequently check in with us. But man, it's fun to take care of motivated patients.
Yeah, absolutely. It's a good population to be around for sure. From Dr. Fralich, from the musculoskeletal injuries that you see, if you give us 5, whatever, give us some common conditions that are presenting to your office.
Well, I often see chronic injuries in our older population. So I'll see Achilles tendonitis, what we call tendinopathy. I'll see tennis elbow, or what we call lateral epicondylitis, calcific tendinopathy of the rotator cuff, where people get these little spurs in their tendons, and we can get rid of those. I certainly see my share of sprains and strains, acute injuries, that is, an occasional ACL, certainly. And oftentimes, if they're a really fit young athlete who is hoping to, play at the next level, we send those to the surgeon. That obviously has to be fixed surgically. But we see a lot of just weekend warriors as well. And we can manage fractures. So we see a little of everything.
Okay. You're casting right in your office.
We don't do a lot of casting anymore, believe it or not. Okay. We can usually just immobilize with a splint, or if it's a lower extremity, a boot and non-weight bearing. But casting certainly still has its place. We see it used. And if I feel like that's indicated, I will send them to someone who can do that for them. But for the most part, we don't cast people that often anymore, at least not for the types of injuries I see.
Okay. There's a big push out there, at least there's a marketing push from companies that are saying you need to have regenerative medicine. It's something you should do. Do you offer regenerative medicine services at your practice?
We do. We offer platelet-rich plasma,
Oh, okay.
and we offer something called alpha-2 macroglobulin, which is where we take the platelet-poor plasma and we manually filter it, and we get these proteins called alpha-2 macroglobulins. And they, in effect, blunt the activity of proteases, which are enzymes that break down cartilage inside joints. And so I don't want to say that it slows down or stops the progression of degenerative change, but it certainly can blunt that inflammatory cascade that can influence the health of a joint.
Okay. So what types of conditions would you treat with those?
Well, from a joint standpoint, any joint that has arthritis,
Okay.
so knee, ankle, shoulder, really any joint. And then for the platelet-rich plasma, we can treat chronic tendinopathies with that as well. So Achilles tendinopathy, tennis elbow is a really good one. And then we can also treat bursitis, so shoulder bursitis, subacromial subdeltoid bursitis. I've had that done myself, and it works like a champ.
Okay.
In fact, there have been a couple of nice studies that have come out showing that PRP long-term works better than steroid for subacromial or subdeltoid bursitis.
Okay.
And so I'm a walking poster child for that. I know that firsthand.
Okay. That wasn't self-treatment, was it?
Oh gosh, no.
Okay.
I had actually an orthopedic surgeon colleague of mine whom I trust do that for me.
Yeah. Love it. So you just said an important word to me, and that's trust. What do you think that you do that's unique in your practice, that when somebody comes in, everybody's nervous when they go to the doctor, whether they have the white coat on or not? White coat hypertension gets everybody nervous. But what do you do to alleviate where people are nervous and build trust with your patients?
That's a good question. I think being myself, I really love what I do, and I hope that shows when I interact with patients. Sometimes I can probably even get a little too excited because I just love what I do.
Okay.
But making sure that I meet people where they're at, I can usually read their body language, their facial expression, and honestly, just listening to the patient. When I was in med school, I would always ask patients, if there's one thing you could tell me that you would recommend to make me a good doctor, what would it be? And 99.9% of them said, listen to the patient.
Wow.
And so I think just being myself, letting the patient talk, letting them tell me their story usually gives me the diagnosis before I ask a single question. I think patients just want to be heard. And a lot of times we don't have the time for that. And in this particular model, I do. And so just allowing them to talk, meeting them where they're at, acknowledging, their fears. Sometimes they're pretty mad that I'm like the fourth or fifth person they've seen, and they're not very happy that they're here. And so, just meeting people where they're at, making sure they feel heard and seen.
Yeah. It's appreciated when you walk into an office and you get somebody that's willing to say, okay, we'll close the door behind you. I'm yours for a period of time, which as long as that takes to find out what's really going on. And if it's the fourth person that they're seeing, as you said, they're angry, and you have to break that down and say, I can understand where you were. You're here now. Let me see what I can do to help you. So that's got to be a great position to be in. And I'm sure that's why you have a ton of referrals in your practice.
Yeah, it's like I said earlier, it's a huge privilege for me to be able to partner with patients that trust me enough to tell me what's going on, and hopefully we can help them, or if not, I can at least get them to somebody who can.
Yeah. That's important too. Not being afraid to refer. I'm sure you would love to help everybody, but sometimes it's out of not necessarily always skill set, but if there's certain things that you don't do, you've got a great referral network that you can get them in touch with the person that can help them the best. And then they're actually going to refer back to you anyways because of what you did for them.
Yeah, I really enjoy collaborating with my physical therapy and chiropractic colleagues. We have naturopaths out there that do some really good stuff. And then certainly I interact with surgeons on occasion, or even folks that are like physiatrists who do back injections, because I don't do a lot of back injections. I just don't know how to do those. And so, we've got a nice network of folks that we trust and that we can refer to, and do curbside consults if we need to, like, hey, what do you think of this? Could you look at this image? What should I do? And yeah, it's this big community behind the scenes that I don't think patients necessarily know about or need to know about. But we do our best to take care of them.
Yeah. In the practice in the like, and you said 16 months is what you've been in private practice
Yes.
for? Okay. Congratulations on that. You know, as you approach those, which is great. It's a great start for the practice. I'm sure it'll go for many years on, but have you noticed that there's an increase in any certain niche injuries that are coming into your practice?
Well, we just started offering carpal tunnel release under ultrasound guidance. And so the one I will say insurance I do take is Washington Labor and Industries, because I'm in the state of Washington. And I did that because I felt like, and continue to feel like, there's a bottleneck for our injured workers getting to see people who can take care of their injuries and actually get them back to work.
Yes.
And so something as simple as a carpal tunnel release under ultrasound guidance can get a patient back to work in as little as 3 days. And so why would I not offer that to somebody if I have the ability to do it? And so that's one we're seeing much more often. We also see a lot of people with knee pain, whether that's patellar tendinopathy, particularly in younger populations. We're seeing a lot of overuse injuries in high school and college kids, which is a talk for another podcast about, sports specialization and how we feel about that, or how I feel about that. But I do see a lot of knee pain. And then tennis elbow is another one that we see a lot of. Okay.
And all of those, again, are treatable in your practice, diagnosed in your practice, and, especially with, I guess, the carpal tunnel in and out from a 3-day standpoint. That's fantastic. I mean, that's great.
Yeah, it's gratifying for me. All I do is call the patient a few days later and say, how you doing? And they're like, I can't believe this. I slept through the night. I don't have pain anymore. My strength is already getting better. And there are no stitches. There's no therapy to do afterwards. It's been an absolute game changer for patients. So we're really excited about it.
Good. And is that, okay, I guess on the reverse side of that, what are people typically doing if they weren't going to you to get that done? What are they doing instead? And I want this to spur somebody's thought that if they're out having coffee or in the church pew next to somebody say, I'm going to go have carpal tunnel surgery, what would they be doing versus what they're doing what you're doing in your practice for them?
Well, unfortunately, a lot of folks just power through, right? And they suffer. And if you look at folks like hairdressers and dental hygienists or whatever, I mean, some of these folks are self-employed. They literally can't afford to take 6 weeks off after an endoscopic surgery for carpal tunnel release. And so, some of them are the primary breadwinner in their family, or they're a caregiver for their partner. They just can't take time off. And so this allows those folks to get back quite quickly without surgery, because historically people have had surgery. Gone to a hand surgeon, and those guys are great. But I will tell you, there are a lot of hand surgeons who are becoming more facile with ultrasound and are now switching to ultrasound guided procedures without the patient having to do surgery, get stitches, go to therapy, be out of work for 6 weeks. So the pendulum is slowly swinging in a lot of areas in musculoskeletal medicine to less invasive because it decreases morbidity, mortality, gets people back to doing what they love to do much sooner than if they have to have a surgery.
Yeah, that's good. Back to, again, Dr. Fralich, where you said you 16 months into practice. So what is your kind of business focus? What are you looking at doing in your business to grow it?
Well, a lot of it is word of mouth in a town like the size I'm in. I've been around a bit, and so people already know who I am in a lot of cases, at least locally. But I think just getting out and meeting people in other communities, telling them what we do, getting to know more about what they do and see how we could perhaps partner together to help mutual patients. The other cool thing is I get to meet these people who are doing some really awesome things for patients that I maybe didn't even know existed. So talking to chiropractors, physical therapists, naturopaths, these types of folks that we often, join the healthcare team with these with these patients in mind. And it's just been fun to get to learn from them and see how they practice, the types of things that they do. And oftentimes when we collaborate, patients get better faster.
Absolutely. Yeah. Team and collaboration. So I was very fortunate to marry a physical therapist and athletic trainer. So we had a combined practice. We were in northern Wisconsin. People didn't understand why you would do that. They're like, if you're seeing a physical therapist, you shouldn't see a chiropractor. Then my first job again was as an orthopedic surgeon. Patients didn't understand, why would you be in this practice? So I think that team approach and that collaboration, you hit it right on the head, that patients do get a better result. If you go to the grocery store and you only buy one thing, there's only one, it's not really groceries, it's there. When you look at healthcare, there's so many different providers that can give the benefit to help that person get the outcome that they're really after.
That's such a good point. And I should put a plug in for athletic trainers. Thank you for reminding me. I mean, they are my colleagues. They're amazing with their athletes. They know their athletes better than anybody, sometimes even better than the athletes' parents know them. And so I love working with athletic trainers. They are smart. They know how to get the most out of their athletes, and they know when to get other folks involved, like physicians if needed. So I love working with athletic trainers.
Yeah, it's a great profession. It's funny. My wife will listen to all the sporting events when she's watching, and they'll see the trainer go out, and she's just waiting for the announcer to say, is it the trainer or is it the athletic trainer? She's always hoping that word athletic, not against trainers, but she loves to hear that word athletic trainer added into it. So it's interesting. Dr. Fralich, I love it if you could share maybe a few success stories that you've had out of your practice so far.
Oh gosh. Yeah, we have a lot actually.
Okay.
Yeah, I mean, we've been able to get folks back to work, like I said earlier, doing the carpal tunnel release under ultrasound guidance in 3 to 5 days. I actually performed carpal tunnel release on one gentleman, and we did both of his hands. Yeah, and he wanted to do them both at the same time, and he was a caregiver, and I said, no, we're going to do those like a week apart, 2 weeks apart. And so he just did phenomenally well. He's thrilled. He's sleeping through the night now. And for me, anytime somebody says that they're not sleeping because of whatever chronic pain they have, that is an absolute deal breaker for me. I mean, sleep is a part of rehab, recovery. If folks aren't sleeping, that influences not just their body's immune system and ability to heal itself, but gosh, I mean, it affects your relationships with other people, your attitude at work, with your family, about life in general. And just your overall experience. So if people tell me they're not sleeping, I've got to do something about that. So when people tell me I slept through the night, that's like a major victory for me. We've certainly treated our share of patients that are athletes. And, I can talk about a football player who had pretty terrible patellar tendinopathy, and we did a platelet-rich plasma injection of his patellar tendon, and he was back kicking and doing great. And family was ecstatic. He was ecstatic. Everybody was thrilled by not just by the results, but the service we provided. That one-on-one VIP type care that we provided for him. We got him in quickly. I always tell athletes and their families, when they say, oh my gosh, thank you for getting us in so quickly, I always tell them, well, you guys are a priority for us. Not that the others aren't, but athletes at that age are a priority because they have a finite amount of time to have a great experience. Yeah. If you wait 6 weeks, your season's sometimes over. And so we need to get those people in, get them seen, figure out what the treatment plan is, and then get going. And so I'm really proud of that. So we've got a lot of success stories like that.
Yeah. I love how you said that. And I'm sure that when an athlete comes in and there's a patient that's sitting there, there may be a little education on that, but I really like how you approach it. They have a finite time to their season, which is really true. High school athletes, very short. Collegiate athletes, a little bit longer, and professionals, it's all the same with that. So that's not really thought of it that way, of why it's important to get them in sooner, but that's very, very, I really appreciate how you share that.
Yeah. And I think as a team physician, we're dealing with these athletes that are semi-pro or professional. That's their livelihood.
Yeah.
And so, not only do we deal with the physical injuries that these athletes are privy to, but we deal with the mental health side of that as well, and how to help them navigate what it looks like if they are injured and are going to be out 2 weeks. Does that mean they're going to lose their starting spot? Does that mean that scouts aren't going to see them? Are they not going to get a college scholarship? Are they not going to get picked up by the next, sports or the next professional team that's looking at them? So there's a lot we have to deal with, not just the physical, but the mental, to help these athletes get better and manage their emotions while they're healing. Yeah.
Yeah. Adding the mindset into that and the mental game that they have, because the injuries that take place, there's so much more. Whatever you see on X-ray, MR, or your ultrasound that you see, it's so much beyond that. It's above or below wherever the injury is, and it always goes up to the stuff that's between the ears. And then it's self-defeating conversation. It's worrying about what is going to happen if they play. It's then parents that are kind of on them a little bit. So I'm sure the guiding approach that you take with your athletes is very much appreciated.
Yeah, and going back to the athletic trainer, these athletic trainers have their finger on the pulse of that. Yeah. They're amazing at checking in with those athletes to make sure that they're doing okay.
Yeah. So let's go back to your practice for a second here. What's the vision of your practice in the next 3 to 5 years?
Great question. It changes day to day, I feel like sometimes. But, we help people stay active and live better. That's our goal. And so if we can continue to do that and reach as many people as we can and have a positive impact on their lives and their health, then I feel like I've done my job. And whether I close the practice or bring somebody on, I'll feel good about what I did for my community. I have some other things that I want to do beyond medicine, but for now, I still really love seeing patients. And so, I'd like to maybe bring on another physician at some point. I like having athletic trainers in my practice. I have one with me who takes care of patients with me and assists me with a lot of different day-to-day activities here in the clinic. And so, we'll kind of see where that goes. But I really like the trajectory of where we're headed.
Good. Well, you're very passionate about what you're doing, so I hope you stay in practice for quite a bit longer.
Thanks.
Patients are out there, but you have to make up your own mind on that. I'll make sure I share all of your contact information, but for the people that are watching or listening, if you want somebody to learn more about you and or your practice, where would you like them to go?
So they can just go to our website. It's www.nwsemedicine.com. I also have a fun podcast that's called What's Right with Healthcare. So you can access that on our website as well. And just trying to spread some good information that hopefully educates, inspires, and empowers people about what's good in our healthcare system.
Yeah. Well, as I said, you've got the voice and, of course, the face and the looks for it, whether you're doing audio or video. So you're doing a great job with it. So
thank you.
2 last questions, Dr. Fralich. The second to last here is from a health perspective. Is there some pointer that you would like to give our listeners or viewers that they could change their health in a positive way in the future? If you could share that with us, that would be appreciated.
I'm a big believer in exercise as medicine. Okay. And exercise, the definition of exercise is different for everybody. It does not mean you have to, go to the gym 5 days a week or anything like that. But, all of the associations that are out there, American Academy of this and that, they all recommend 150 minutes of exercise during the week. And so that can be broken up into 30 minutes, 5 days a week, or 75 minutes of a higher intensity exercise twice a week. We also want to encourage 2 to 3 days of strength training, whether that's body weight, bands, or actual lifting weights. Okay. But the take-home message I would say is exercise is medicine. So get out and move, stay moving. The worst thing you can do is stop moving. And if that means the weather's crummy, do marching in your house, or do burpees in your house, or do planks in your house, or go to the mall and walk in the mall, or walk on a track. This is all free for us to do. It doesn't have to cost a lot of money. You don't have to hire a personal trainer, but Stay moving. And if you do those little things every day, we've had some people that we just challenge them, walk to your mailbox every day for a week.
Mm-hmm.
And then pretty soon they're walking to the end of the block.
Yeah.
And then pretty soon they're walking 2 or 3 blocks. And before you know it, they come back and tell you, you're not going to believe this. I walked a mile.
Really?
I mean, it's the coolest thing. So it starts with one small step. Exercise is medicine.
Yeah, it's important. A couple of things on that. The mentality shift that they've had, they're like, I don't want to walk. I don't want to go to the end of the block. I don't want to go to get the mail. Once they've done it, it gets easier and they take that next step. What they don't understand is that, of course, it's helping them physically, but mentally as well. I'm sure that they have a smile on their face a little bit more than not. And a point to that you said that, once you start, continue. My son and I went down to the Sawtooth Mountains in August and did a hike into up in the mountains. And I wasn't prepared for the difficulty of what it was. We were at the divide going down into the Barren Lakes, actually. And we met a couple that was in their mid 70s. And I went up to him and I said, I don't mean to offend you, sir, but could you tell me your age? And he said 74. I said, how do you do this? And he said, once you start, don't stop. So for me, my perspective, it was the first time, it was my first walk to the mailbox. I was like, I don't think I could ever do this again. I'm not sure I want to do that trip again, but it's the fact that he said, once you start, don't stop. So it goes on to that same point.
Sawtooths can be humbling, no doubt.
Yeah, beautiful.
Yeah.
But yeah, it was a trip of a lifetime with my son. It was great. I appreciate that.
Fantastic.
Yeah. Last question, Dr. Fralich, if I can. You're on the Prime Health podcast as a guest. Everybody has a different approach to this, but what would your definition of Prime Health be?
So I thought a lot about this. My definition would be really leaning on the 6 pillars of lifestyle medicine. Mm. And so for people who don't know what that is, you can go to the American College of Lifestyle Medicine website. And the 6 pillars are optimal nutrition, restorative sleep, avoiding risky substances, physical activity, connectedness, and stress management. And if you can try to practice just one little snippet of something from each of those areas, some are easier than others, certainly. I think that is going to give you the best chance to, live as healthy as you can possibly live, and as happy as you can possibly be. Because as you said earlier, I mean, physical health is certainly connected to our mental health. And so I'm a big fan of lifestyle medicine. So if people want to learn more about that, they can go to the American College of Lifestyle Medicine website. And there's a ton of cool information there about how to live a better life and a healthier one.
Yeah. Well, thank you for sharing that. I've had lifestyle medicine physicians on that have not answered it in that question. So I appreciate you showing them up as a physician that you are. So that was good.
We use it in our practice all the time. So we talk about that all the time. People ask me like, what can I do to prevent this injury from happening again? Or, I just had a PRP injection. Is there anything I can do to really, maximize this or optimize this? And we talk about the 6 pillars.
Mm-hmm. Yeah. Well, this has been a pleasure for me, Dr. Fralich. I appreciate it. I said maybe 30, 40 minutes. We might go over a little bit in the conversation. So
it's okay.
Yeah, absolutely. I love your past history of how everything that you've done is built upon it. And I think that that's a testament to who you are and what you've done. And what I don't think people understand from a patient perspective is what you've put into your career prior to helps those patients more and more and more. They go in because they hurt or they want something fixed. But in order for you to give them the best of care, you've had to go through trials and tribulations yourself. So hopefully more, not too many trials and tribulations, but more joy along the way. But it's always hard to have that. So I appreciate, you sharing it with our viewers and our listeners for sure. So I always say selfishly, of course, we would love for you to share this. If there's somebody in the Spokane area that you think could benefit from what Dr. Fralich can do and around the Pacific Northwest, please, by all means, do share this with somebody. What she's doing is unique, but more people need to know about it, not just because she's been in practice for a short period of time in her own practice, but because people can truly benefit on that. So please do share. Selfishly, I always say share our podcast. We'd love to have more people, hear about it. But as I always say, until next time, remember that true wellness is a journey we are all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward does matter. So please do stay committed to your Prime Health journey. And again, Dr. Fralich, thank you very much for being guests on the Prime Health podcast.
Thank you. It was a pleasure to be here.